Welcome to Working Smarter, Concise Compliance Conversations featuring Wendy Rubis, sponsored by Village MD, primary care physicians, practice medicine the way you've always wanted, data, resources, and clinical decision support to care for your patients inside and outside the exam room.
Hi, welcome to Working Smarter. I'm Wendy Rubis, General Counsel of Village MD. Today we're talking about the opioid epidemic, and we have a special guest who's going to be joining us in just a little while. But before she joins, I wanted to just give a little background to our listeners about what we're talking about. This is our second podcast talking about the opioid crisis. In our first episode, we described the scope and nature of the national problem. Today, we're talking about what's going on with enforcement of drug manufacturers. And me personally, I was not really aware of this until I read in the news that there was a deposition that was sealed that became unsealed. Because when a deposition is sealed, you know it's good. And anytime you read in the press, something's been unsealed, it's a good day to just go and read it. So I did that on a Saturday in March, which is sad but true. I spent a Saturday in March reading this deposition, and I could not believe it. It stayed with me for a long time. The main thing to know is, first of all, go read it if you have the time. But second of all, what I learned was a deceptive marketing that was conducted at the highest levels of Purdue Pharma. And they intentionally went about educating primary care physicians that OxyContin was not as potent as morphine, that it was not addictive, and that it should be used for patients with chronic pain like with arthritis. The sales campaign was aggressive and highly effective, and OxyContin sales soared. They made millions and millions and billions of dollars. The evidence that was presented in this deposition was so compelling and fascinating. They sat with the former CEO and they showed him document after document, his own emails, his own memos, where he had knowingly promoted the idea that it was not as strong as morphine, and knowingly spread the view about how to use it and how to sell it. It's so important that we are aware of this, because we talked about the Sunshine Act in a prior episode. The pervasive and insidious effect of drug manufacturer marketing is one of the reasons our healthcare costs are so high. It's one of the reasons why primary care doctors need to get back at the center of care. We have to just stay aware of it. That's really the background for this important topic. And it's my great pleasure today to be joined by Pat Stein, who's the Assistant Attorney General in Texas. Pat's been with the Attorney General's office there for 13 years and is part of the team that's investigating and doing education outreach and supporting the lawsuits relative to the opioid manufacturers and the opioid crisis. So Pat, thank you so much for joining. It's nice to have you with us today.
Thank you very much, Wendy, for having me today. I appreciate the opportunity. And I just want to tell the group that the opinions that I expressed today are mine alone and not necessarily those of the Texas Attorney General.
So Pat, can you tell us a little bit about how the Texas Attorney General got involved in this, which I think was several years ago, and kind of how that's evolved?
Sure, I'm happy to discuss that. So in the earlier 2000s, the Texas Attorney General and I believe 23 other states did an investigation of Purdue about their marketing of OxyContin. And I know your listeners know that OxyContin came onto the market around in 1996, I believe. It was a long-acting opioid. So what happens is a group of states work together to enforce their UDAP statutes, or Unfair Deceptive Practice Acts.
Okay.
And what we did was we got together and investigated it and reached a settlement with Purdue. In 2007, the DOJ entered a settlement also with Purdue for $600 million in civil penalties and fines. So then time goes forward, and as you know, the opioid crisis became worse. I think now, today, they say 47,000 people died of opioid overdoses in 2017.
Wow.
I believe as of today, 42 states have filed lawsuits against manufacturers.
So one thing that I noticed when I was reading some of the material, the Sackler deposition in particular, which I mentioned, there were a series of settlements back in 2007 around that time. And yet now there's another wave. How is this wave of litigation different than what you saw back then?
Well, in the first wave of litigation, the states didn't file suit. We were able to reach a settlement. I think Kentucky was the only state that filed a suit. The opioid crisis is much worse. I think we're facing a public health crisis. And the thought
So,
is
but did the
that
deceptive marketing continue then after 2007, or is this about the same exact conduct, or was it
uh,
subsequent?
you'd have to read the lawsuits. I can't really comment much on ongoing
Okay,
you
got
know,
it.
lawsuits and allegations, but it's what we're saying is that they misrepresented the addictive nature of opioids. So
Yeah.
I don't think it's identical, what they said, but we believe it was still there. I think that over time the science changed too. I think your listeners will remember that in medical school in the late 90s and early 2000s, they were taught too that opioids weren't addictive. And so I think what was commonly believed and what we know now has changed over time as well.
Yeah, and another, I think, this is so multifaceted. I remember working in hospitals at that time. Pain was considered something that you were required to alleviate. It was a quality of care measure. So there was a lot of pressure to address pain. I think some of that is changing in healthcare as well.
Right, because in like 1996, it was the fifth vital sign. So there was
Yeah.
heart rate, blood pressure, respirations, and temperature, and then it became pain. And the Joint Commission evaluated hospitals on their assessment of pain. And as I said, practitioners were taught that opioids were not likely to addict, as opposed to what had previously been taught. And actually, I was a nurse at the time in the 80s and 90s. And that came, as a result of people believed that pain was undertreated. But
Yeah.
I don't think anybody foresaw, that the outcome would be to give everybody opioids, all the time. So
Right. The current litigation is underway. Do you expect that that'll be going to trial?
there's a trial that's going to take place in Oklahoma on May the 28th. I believe it's Oklahoma versus Janssen and Teva. Purdue is already settled in that case. So
Okay. Is that the one that I read is going to be televised?
they're going to have cameras in the courtroom. That's true. I don't think it's going to be like live TV, like in the OJ trial or something like
Oh,
that.
got it.
But
Okay.
but it
That is what I was thinking.
watch the Oklahoma trial. It'll all come out, over time. So
Yeah, it was good. Well, maybe we'll have you back when you can discuss it in more detail.
yeah, okay, all
We'll
right.
go. We'll go. We're just going to call that episode "Spill the Tea, Pat." Hey, Pat, spill the tea. Well, one of the backlash from the early wave of litigation I think I've read is that people felt because it was settled that the problems of the deceptive marketing and so on did not become known. So maybe the televised trial or the cameras in the courtroom will help. But what else is the Texas Attorney General doing to address the outreach problem and making this information more available?
Well, what we've done is we've created a dose of reality program. We have a website, and the idea behind it is to provide information to physicians, to businesses, to veterans groups, to educators and parents and senior citizens. And what it does is it provides information about the signs of addiction, the risks of addictions, and how each of those groups can get help. We also on that website have a drug take-back site where you can click on it and you can find drug take-back programs or places, pharmacies or whatever that will take back your drugs. And the idea are opioids.
So we saw the Dose of Reality website and so comprehensive and helpful. We'll make that website available in our materials to our listeners. Is that program been successful? Are you getting good feedback about it? Do you hear people using it?
Yeah, so far so good. I think we just put it up like 2 months ago or something. So yeah, we're trying to publicize it, and we really, like I said, we really want people to become educated about the risk of addiction, such as physical therapy and non-steroidal anti-inflammatories and all sorts of things to consider. It's not just getting a painkiller or getting an opioid.
Yeah, I think it's so interesting that what you're saying about the science changing because, as you mentioned, the CDC has put out guidelines, and one of the big, hotly debated, I guess, issues in the Sackler deposition, but also in the litigation was and I was so fascinated to learn about this, but the efficacy of OxyContin for pain versus, you know, just an ibuprofen for pain, there wasn't as big of a difference, I guess, as I had always thought. And so I think the message to primary care practitioners is to maybe start conservatively with the over the counter, not to go directly to one of these opioids, which is exactly the marketing message that I think Purdue and others really flooded their offices with this message about OxyContin.
Opioids have their place, like in hospice or or different post-op after surgery. They have their place. But the thing is that they be used appropriately.
Last month, we saw the Department of Justice, the U.S. Department of Justice. They do their takedown once a year, which is such a great, salacious name. They do arrests across the country and on either the same day or the same, period. And I noticed this year, 60 people arrested, 7 states. So the scope was a little smaller. And it seemed to me that they were really primarily focusing on opioids. A lot of our audience is physicians and primary care practitioners. What would you tell physicians in terms of, what are you seeing in terms of enforcement, or what are the things they should be aware of?
Practices that these doctors and nurse practitioners and pharmacists were doing. Some examples of it, what they were trying to do is prosecute medical professionals and others that were involved in illegal prescription and distribution of opioids. And that's, I emphasize illegal. In other words, when people were prescribing drugs for other than legitimate medical purposes. There was a medical professional in the Western District of Tennessee that was referred to as Rock Doc, and he exchanged opioids and benzodiazepines in return for sexual favors.
What?
I know. This behavior was, I don't think this is what your routine primary care provider is going to do in his everyday
This is egregious conduct, not the run-of-the-mill,
No.
maybe, because physicians are put in a situation many times in their offices where they're making a judgment call and they're trying to ascertain, is this a drug seeker or is this person have a legitimate, need? But what you're telling us is that the enforcement and prosecution, that isn't what they're looking at.
No, it doesn't appear to me. I'm not directly involved, but there was also, this one was really bad, a 30-year-old patient in Alabama allegedly overdosed after being prescribed more than 800 oxycodone pills over 2 months prior to her death. And then the doctor who prescribed them directed the patient's husband to dispose of all the pill bottles before the police arrived at the scene. So this is, like, as you said, egregious conduct.
Wow.
But I have a list of things that that the DOJ looks at, and then some ideas of what physicians can do. In their everyday.
That'd be great.
So some of the things that DOJ can look for is it's a cash-based practice only. The practice.
So in other words, the patients are paying cash, or in the one case, other favors. But in other words, not billing insurance, Medicare, et cetera.
Correct. There's a high number of out-of-state patients, so when people are coming to a certain prescriber or a pill mill. If you look at the comparison to all the drugs when prescribed, Schedule 2 and Schedule 3 controlled substances are disproportionate. A high number of family members in a pain managed practice.
Oh, meaning they go together? They all go to the...
Yes. Or a group of people working together that are a family, I guess, in their own practice.
In the practice or the patients?
In the practice.
Oh.
A lack of interventional techniques or physical therapies, like all they're doing is offering pain pills. They have a high number of doctor shoppers come, and they see a high number of patients per day. And then sometimes there are what they call marketers. They gather potential patients together and drive them to a pain management clinic. And then once the patients receive the prescriptions, they sell it to the marketer, and then the marketers can, can distribute the pills as they like. The offices are open during unusual hours, limited number of support staff, like no nurses, medical assistants, or that sort of thing.
Got it. Okay. So these are factors red flags that you're saying would trigger enforcement.
Right, exactly.
I was wondering what you're seeing in Texas. Do you guys have any way of knowing? Many of our providers are in Texas. Is there been any abatement of the problem? Is it raging? Is it getting better? Are you seeing any change?
I believe, I don't have the numbers right now, but I believe the problem is getting better. I believe that the prescribing of opioids is decreasing somewhat. I think that physicians are getting the word and are looking at their practices.
That's obviously a trend we're hoping that continues. Pat, is there anything else that you think our listeners should know about this important topic?
I think that, I've heard that the concern might be, how can physicians still be compliant with the law and still, respond appropriately to patient needs. And I'd urge them to check the prescription drug monitoring program in your state. I'm sure they are aware of what the regulations are for checking it, but there are people that are doctor shoppers, and they will go from doctor to doctor to doctor. And you might not know that in your practice. It might be a nice-looking, middle-aged, older woman like me who's coming around asking, smiling nicely, and asking for pain medicines. Consider the number of opioid pills prescribed for acute pain in the initial prescription. And I'm talking about acute pain, not chronic pain, not hospice care, that kind of thing. But according to the CDC, 3 to 5 days is sufficient. And some states are passing laws to limit the prescribing of the initial prescription for acute pain. I think about 35 states have done something about that. So consider what you're doing. And I think doctors are limiting, or providers are limiting themselves already, but this is like when I talked about it with my internist. She said, well, that way I could just tell them it's the law instead of having to,
Yes.
argue with them. It wouldn't mean like you couldn't order it again. It just means that you would have to check them out, before
Right.
you order more opioids. There's a bill in the House that might make it through that addresses that
Got
in
it. Got it.
this legislative session.
That's very helpful, Pat. Thank you for the background, and thank you to you and your team at the Texas Attorney General for the work that you're doing to bring to light the deceptive marketing that is going on. I just think it's something that we just almost cannot talk about enough, that the marketing by drug manufacturers has been a failure when it comes to the opioid crisis. And in particular, the work that you're doing with Dose of Reality is proactive and helpful. We're big supporters of that work. So thank you to you and your team for all the work you're doing. We so appreciate you joining us today. So thank you very much.
Thank you.
Thank you to our sponsor, Village MD. We hope you will join us for future concise compliance conversations.